Paradigm Outcomes is the nation's leading provider of complex and catastrophic medical management services. Our clinical specialists are part of the injury management team that puts the injured person's recovery first. This dedication and expertise sets us apart. One such expert is Diane Atkins, an occupational therapist with 37 years of catastrophic injury experience. As a Paradigm clinical specialist, she provides guidance and input for the most complex rehabilitation issues. Hi, Diane. Thank you so much for being with us.
It's a pleasure. Thank you.
Tell me a little bit about your background.
My area of expertise is specifically upper extremity amputee rehabilitation and the challenge that brings. My exposure to upper limb amputees covers approximately 1,500 plus. Unilateral and bilateral limb loss, generally related to catastrophic injury, major catastrophic injury. And with that, I also bring my exposure to the state-of-the-art of upper extremity prosthetics and the very unique advances that are happening in that field today.
Wow, that is quite the background. So what are some of your responsibilities then with Paradigm?
As an occupational therapist, I have unique exposure as it relates to functional outcomes. And this relates to their ability to return to an independent way of being within their home environment and also return to work, which is very, very important for these individuals. So being able to lend my expertise with that element of care is very important. But along with that, in the management, clinical management of the amputee, I help the team direct their efforts toward the very best state-of-the-art clinical programs in amputee rehabilitation throughout the United States. Because of my many years in this field, I do have exposure and awareness and a working relationship with many of these individuals. One of the very unique and necessary parts, I feel, of what I add and bring to the table with a team is my understanding of prosthetic options that are available for upper limb amputees. There is a great deal of difference between body-powered and electric, and because I've been exposed to the majority of them and in fact have written protocols on the most advanced state-of-the-art multi-articulating limbs right now, I can help not only articulate that to the team, but at times I'm also called upon to help coach the treating therapist in the particular location where the patient is being treated to make certain that the best functional outcomes are being achieved.
That sounds like a critical role in the injury management team. So tell me more about how you work together with your Paradigm colleagues and treating therapists.
When an accident or severe injury occurs, I'm usually involved with the Paradigm management team discussion at a very early time, generally within the first 2 to 3 days. I like that. I think that makes a huge difference in terms of the overall medical, therapeutic, and prosthetic management that needs to occur for this individual. We work collaboratively in our discussion about those various components. And perhaps where I feel I can add my particular area of expertise is as it relates to the prosthesis.
So even among your colleagues, you offer a unique perspective.
Yes, I like to think that I do. Because there are so relatively few upper limb amputations as compared to lower limb, correspondingly, occupational therapists, unfortunately, do not have the exposure to these individuals on a regular basis. In fact, many times, maybe 1 or 2 a year, they may see. So because experienced therapy management is essential in the successful outcome for these individuals, I find myself involved with dialoguing with them in almost a coaching role to help them better achieve the outcomes that I feel are achievable for these folks.
It sounds to me like you're heavily invested in making sure the injured person gets the best care possible.
That's exactly right, and that's why I have really enjoyed my years with Paradigm. Working in a collaborative team environment where all of us are committed to achieve the highest possible quality of life and function for the individual is ideal. Combined with that, the professionals that I work with on the Paradigm Management team are second to none. It is a true privilege to work with them and see the results that we're able to achieve.
Well, thank you so much, Diane, for sharing what you do with us today. Diane's contributions in this ever-changing field help Paradigm's clients stay informed about state-of-the-art clinical advances and allow Paradigm to deliver the best outcomes for the most costly and complex cases. For more information on our team and services, visit paradigmcorp.com today.